Warm welcome to you and thank you for joining us on Health and Wellness this evening. My name is Zaitun Ali. We are definitely coming to you from the Fairview Hotel right here at Bishop Road in Nairobi, Upper Hill. And today's conversation is about plastic and reconstructive surgery. Yes, there is a difference, and all this aid at either adding, removing or correcting certain parts of our bodies, either because of an accident or just because of it's by choice, you know. You decide to just enhance and beautify yourself in terms of aesthetics, and we'll get to know the difference right now. And on my set, I have Dr. Evans Masitara. Yes? I said it right? Mm-hmm. He is a surgeon at the Da Vinci Medical Group. I also have Samuel Mbithi. He is a beneficiary of this procedure. And to my right, I have my audience. They are going to be part and parcel of this conversation. And welcome to the show. Dr. I'll have to start with you. And we need to know the difference between, all of this is plastic surgery, right? But we need to know the difference between now the cosmetic surgery and the reconstructive surgery.
Okay, maybe we start with the basic definition. Plastic surgery comes from the Greek word plastikos, which means to mold. Then that's the broad name of the field. It is then subdivided into reconstructive and aesthetic surgery. So under reconstructive surgery, we're talking of people who for some reason have deformed parts. Either they are born that way or they get into accident or get burn injuries, then we kind of have to reconstruct to make it normal. On the aesthetic arm, we are talking of normal organs, normal form, but people might need to enhance it, like maybe you feel you want your nose a certain way, or any part of your body you want it enhanced. That's pretty much the difference here.
Okay. And Samuel Mbithi, maybe you can take us through your journey. Which of these surgeries did you have? And you can take us through the journey.
So I went through the reconstructive one.
Okay.
That is majorly the aesthetic, right, doctor?
Yeah, sure.
The aesthetic one. And
that's the aesthetic one?
No, reconstructive.
Reconstructive surgery.
Reconstructive,
yeah.
okay.
Yes.
Yeah.
So basically what happened, I got burned 11 years ago. It was an incident that happened in the house. We had just a confrontation with someone I knew. Okay. And then it ended up to actually myself having the burns on my body. Like that person poured paraffin on me and then lit. So I was kind of burning in the house alone. I was able to rescue myself through, I just poured myself water, and then fire went out, and then I was picked from there and then taken to an hospital. So the journey began from that process, from the burn management, the wound management, all the way to where I am today. Yeah. So it's been like 11 years, 8 procedures. First 5 procedures were majorly on skin grafting, okay. And it was majorly affecting my movement. Like if I can say, my limbs were not able to freely move. Also my neck was kind of, these are connected to the chest.
Those are the parts that you got the severe burns?
Exactly.
Okay.
So if I have to make some movement, I have to move the whole of my body, not the joints. So the procedures were majorly done on the arms and then on the neck also. So those ones kind of not really helped me achieve what I wanted to achieve at the end of the day. Then that's when we started a different journey with Daktari, that is on free flaps. Then we did the first one, and then the second one that the parts were picked from one of my legs, and then it was put on the neck. Yeah.
Okay. Dr. Evans, could you tell us about this case? So how did you start the process with him? At what point did you actually receive him as a patient?
Okay. It might be like 2-3 months ago.
Okay.
His main issue was the neck contracture. By that time, I think the rest of the problems had been sorted out by the previous doctors he was seeing. So he couldn't quite have a free movement of his neck. So our surgical goal was to remove the contracted skin there and put in healthy tissue which can allow him to function normally.
Okay.
Yeah, as in any surgery, our first attempt, we used something that is called a local flap. Kind of took it from his arm here, then we turned it.
Ah, really?
Yep.
Yeah,
Okay.
we turned it to bring it to the neck. Unfortunately, there was a small complication, so it didn't quite give us the result we wanted.
The complication came about because of what reason?
Okay, there's something called flap take. Sometimes the tip of the flap does not take well, and so it ended up covering half of his neck instead of the whole neck.
Okay.
Yeah.
And that didn't really look too good. So we decided to do a different operation. Now take enough skin, because also the limitation with taking from the arm, we couldn't get as much as we needed.
Yeah.
So for the second operation now, we took tissues from his thigh. It's called a free flap. You now do microvascular anastomosis, which means you join the vessels of that tissue here to the vessels in his neck, so that it can survive there. So this is the one which worked, and he's still in the process of healing, but I'm sure when it's fully healed, to give us a good result. Yeah.
So how did you prepare him for this surgery?
Okay, obviously there's a psychological element. You have to tell him, like, okay, it's a journey for starters. It's not going to be like a once-off and you come out brand new. No, it's a journey, and like any procedure, it has its risks. It's not 100% guaranteed that it will succeed. So a patient has to give informed consent. You explain to them explicitly the advantages of the procedure, but you also explain it to them what can go wrong, so that they can make an informed decision. Then obviously give him time to decide, to do also his own research, to see what other options are there. And then when he decided he wanted us to proceed, then we went ahead to do the procedure. Yeah.
Maybe Samuel, will you take us through? It's been 11 years of this treatment here and there with other doctors. How was it like for you during this period?
It's not an easy journey. Probably anyone who has been through something similar to what happened to me, they can attest to that. It's not something easy. During the process, you get to lose a lot of people who are closer to you. You get a lot of self-esteem issues. You start also getting mentally disturbed, and also the physical challenges like the ones that you can see.
Yeah.
So I went into depression at some point. I didn't know that I had gotten into depression. I became an alcoholic so bad. I didn't notice anything. Like, to me, life was just like a normal thing.
Yeah.
You know, I'm just waking up in the morning, going to work, but there's something that is really disturbing me. I couldn't sit anywhere near a lady because it's a lady who caused the same thing. So I had that hatred bit.
And what happened to this lady?
We tried pursuing justice.
Yeah.
Just the other day, I think 2 or 3 weeks ago, that's when I went through some of the court documents that I found in my possession. And unfortunately, she was released 3 months to my injury. Like, I got injured on 17th of October 2012. But by February of the next year, that is 2013, she was already released on basis of lack of evidence, lack of witness, I don't know, and all that.
Were you not there?
I remember the investigating officer coming to the hospital I was admitted.
Yeah.
And I was not in a position to actually write a statement. I think those days they majorly based things on writing. So I was not in a position to write or scribble anything of what happened.
Yes.
But we communicated and told them that when I get out of hospital, then we can proceed with this. Because right now my focus is
healing.
To get the healing bit of it. I don't know what happened during that time. So she was released. I tried pursuing the case for all that time. It got to a point I just gave up. Like, now, let me just focus on my healing, because the other bit is not giving me any fruits at the end of the day. So it was up and down, following up with the the law court, Mavoko Law Court.
Okay.
The investigating officer was from Lolongo Police Station, but nothing was coming out. So I wrote a letter to the DPP by then, requesting to have that file brought back to the court so that we can get to understand what is going on. Then I got a letter again from the DPP that they cannot, because I think the section that really moved that issue from the court, it's beyond my control. So I'm still in that process.
Okay.
Yeah.
And perhaps when was the turning point as to the time that you went and sought help? Yes.
Like I said earlier, I had not known anything that was happening in me. To me, everything was just okay, because I was still working by then, but with a lot of difficulties. Then there was a guy who had noticed me at some point, and he was trying to talk to me frequently and asking me a lot of what happened to me. I was so thorough with him, but I used to lie a lot, because not everyone would pick that story from that point as a true story. Like nowadays you look at social media and people are like, we want to hear the other side of the story. Yeah. But why were you even there? You know, it really makes you feel like people don't believe exactly what you're trying to tell them. And then when you look at the society, probably by then, I don't know whether nowadays still the same, such an issue could not happen to a man. Like, how can a lady overpower you and do such a damage to you? So you have that issue of I'm a man, but I failed at this part. There's a cousin of mine. She was doing psychology at that time. She also identified a little bit of my characters and some changes in how I'm interacting with people, how I'm also talking to her, you know. Then she sat me down. I had gone through what we call the biblical counseling, which is, I would use these words, basically, just God loves you, you know. Yes. You will get better. But no one is really showing you the way to moving from where you are to getting the better. You're just hearing the word, you'll get better. But how? So she was able to identify some of these traits, and we talked a lot. She used to have a sitting with me like sometimes 3-4 hours in a day, just talking. And I remember one day when she told me, like, there's a name she normally calls me. It's a Kaushago name. Like, she used that name, like, I want you to understand that you have these scars and you live with these scars for the rest of your life. Some of them are permanent. We will not be able to control them from this point. So the moment you accept the fact that you're this way, that is the moment your healing will begin. As much as you've forgiven the person who did this to you, as much as you've tried to talk to people, but inside yourself, if you've not really accepted the fact that this is who you are, then it will never change. Because I used to put on gloves, I used to put on full necks to just hide my scars. But when I'm walking, you can clearly see there is a deformity in that person. So I went through the journey with her, and it was difficult, it was interesting at the same time. It was like now fact speaking. It's not about hiding the truth or how are you feeling about women, how are you feeling about this condition, you know, if such a thing can probably happen, what are red flags that you need to be checking on, you know. But again, when you focus majorly on just looking at problems into people, then it also becomes difficult for you. So that's how the journey was. We still talk up to date. I still find myself wanting to speak to her whenever I find myself, because I always have sometimes ups and downs. I have the laws of life, like niko kwa ofisi, I'm working, but I feel like no, something is really giving me a headache. Then you realize that I cannot really share it much with my colleague or anyone within that environment. I can only give her a call, and then she'll create that time, and then we talk, and then I feel relieved.
It is understandable.
So I'm actually working on my tomorrow, not the past, because the past is already gone and I can't change it.
That's a very good choice. And when did he undergo this surgery?
Oh yeah, Da Vinci Medical Group.
Okay.
It's a hospital in Kilimani. We are mostly specialized in plastic surgery. Yeah.
And how long was it?
It's like a 6-hour surgery. Yeah.
The preparations and everything. So now he is in the healing stage.
Yes.
How long will this take? And what are the processes that one can take in terms of now treating the wound and everything?
Okay, now, like the whole process, you come, say, on the morning of the surgery, we prepare you, then you get in the surgery, like this was 6 hours. I think I was admitted for 2 or 3 days, just to check that things are okay. Then after that, it's mostly wound care. You just come in, maybe after every 3 days, we change the dressing, see how it's healing. And yeah, we expect full healing within the next 4 to 6 weeks. Then after that, although we call it reconstructive surgery, you also need to make it look acceptable.
Yes.
So you then have revision procedures to make it look like it's a native tissue from the neck. Because you can obviously imagine taking tissue from the thigh. It might be bulkier than how your natural neck would look. So after some time, we can then come back and do maybe like a liposuction, suck out the fat and make it flatter, make it look more normal. Yeah.
Perhaps the complications that arise as a result of these procedures, maybe you can tell the people.
Okay, generally speaking, complications can be divided into early or late.
Okay.
So obviously, because there's cutting, you can bleed. Like early on, during the operation, you can unfortunately have uncontrolled bleeding. Though, you know, if you're working with people who are qualified, the chances of those kind of complications happening are minimal. Then post-operatively, it's more now to do with the wound. You can get an infection where we've operated on, or the flap might fail, or you know, get wound dehiscence, those kind of things, poor healing and stuff. Yeah, those are the kind of things we would expect with this kind of surgery.
And this was his case. So probably there are other cases that also come to you for reconstructive surgeries.
Yeah.
And also plastic surgery, or not plastic, cosmetic surgeries, yes. So perhaps aside from maybe getting a burn, what else can you treat? What other procedures can you do on other people?
On cosmetic side or reconstructive side?
Reconstructive first, and then after the break we'll come back with
no worries. Now, reconstruction, like I was saying, it can either be congenital, which means you are born with it, or it's acquired, right? So for congenital conditions, you can have like kids who are born with defects on the lips. You've seen those kids with cleft lips, cleft palates, or any other defects. Some people are born with fingers which are fused, which is called syndactyly. You're born with extra digits, called polydactyly. Those kind of inborn errors, those we can operate and correct as plastic surgeons. Then on the acquired bits now, it's pretty much head to toe, anything that can happen. I mean, like history is saying about him being burnt. I think we had a patient whose nose was bitten off by prospective boyfriend of some sort. So now they come with like 3/4 of the nose gone. So you now have to kind of reconstruct.
Like bitten, a tooth. Someone bit.
Yeah, like
literally.
Maybe I ask you for a date once or twice, you keep saying no. Then the third time we meet, I'm like, let me bite your nose off.
When we are not allowed to say no.
Yeah.
Are we not allowed?
Unfortunately, I mess up people in this world.
But yeah, thank you so much for that.
So yeah, those kind of things. And some other guy, well, I didn't quite believe his story, but you know, I have to because that's what he has told me. But his ear was bitten off, and he says it was in a bar fight, right? I don't know what disagreement they had, so you now kind of have to make him a new ear. Then you see that maybe moving down here, you see like ladies who get maybe breast cancer and stuff.
Yes.
The breasts have to be removed. And it affects your confidence, and so you can. Plastic surgeons can also reconstruct a new breast for you using tissue from elsewhere in the body. Then,
okay,
that's kind of a summary of the range of products of procedures we do.
Okay, That is well noted. Lesson learned. Do not go at a bar. Do not say no to a man. Yeah, I'm joking. But yes, the conversation is still going on right here on health and wellness. And we want to take a short commercial break. We'll come back as well, and we'll learn about now the cosmetic, the aesthetic one, the cosmetic surgery. So don't touch that dial. Stay tuned. Welcome back to Health and Wellness. My name is Zaitun Ali, and we are filming right here at the Fairview Hotel, and the topic of discussion is plastic and reconstructive surgery. So we've had a chance before the break to hear about Samuel's story, and also Daktari has mentioned a few things about the surgery, the treatment and everything. And right now, after the break, I will be able to involve my audience in this conversation. And someone permanent is here on the show, and she'll also take us through the journey, how it has been, especially seeing Samuel going through this. And Daktari, before we go on to the audience, I just wanted you to touch on cosmetic surgery. So we've talked about reconstructive surgery, okay, and you can talk about now cosmetic surgery, the effects and everything about it.
Okay, so cosmetic surgery, what we're basically talking about is enhancement of organs and forms which are normal. Say, for instance, in the face, you might want to get rid of wrinkles, you might want your lips fuller, you might want your nose to be a certain shape. Moving down the trunk, you know, after breastfeeding, a lot of ladies might want their breasts redesigned, get a breast lift, get a breast augmentation, liposuction, or adding fat to other areas. Maybe you feel your hips can be wider, we can do that for you. Or some, I'm forgetting which area they come from, but there are some people with like really skinny legs, and it makes them feel self-conscious, so we can transfer fat from the tummy and put it onto the legs, and yeah.
And these surgeries have been quite common nowadays. People do have money, really. How much does it cost for one to just come and maybe get a boob lift, hip enlargement?
Okay, there are ranges. I can't give specific figures because, you know, it's patient specific, center specific, but we are talking anything between $3,000 US to $5,000 US. That's why.
So you also do it? People can come to Da Vinci and... Okay,
yeah.
Okay. So perhaps the side effects of these ones, I'm sure they are quite a lot. Maybe you can mention. I
think there's a misconception that it comes with a great lot of risk, because there is also misinformation on some media platforms, social media and stuff. The other source of misinformation comes from people who go to, you know, countries where you do not know the qualifications of the person operating on you. So someone can come and say, I was in country X, I had a BBL done and the results were terrible, but they didn't take time to see the qualifications of whoever it is.
So they get botched?
Yes, they get botched.
Oh,
yeah. But in the hands of board certified people, the complication rate is quite low. Because like you are saying, this is a normal person, this is someone who's healthy, they have no other medical problems, and they come. So already their chances of having a successful surgery are higher. Having said that though, any surgical procedure carries with it a risk. It can either be from the anesthesia or, you know, unforeseen events, or even with the healing, something can go wrong. Although, you know, percentage-wise, it's a very low percentage. I can't quote a figure, but yeah.
Okay, so for Samuel, what results is he anticipating for after this surgery?
Well, like we had a discussion with him, it's a journey. For him, for reconcile, we have to do like multiple surgeries.
This is not the last one. It's not the end goal.
After now this has healed, we now come and refine it, make it look better. If at some point you're like, oh, I want something again for my hands, then we can look into the options of saying...
You'll finish all parts. Can't you get this? It has to come from you. You can't get it from maybe someone else. Let me just ask.
Yeah, okay, it's easiest if it's coming from you. Yeah. But you see now with skin, what you can do, you can expand it. You get like how if a woman is pregnant and the baby starts this small, by the time they're 9 months pregnant, the skin is like this. Yeah. So you can imagine if we were to put an expander under your skin, right? And slowly add water, slowly add, we can expand the skin. Yeah. Then when it's big, like the sufficient size, we remove the tissue that is scarred and now use the one that we have expanded to cover the scars. Okay. So those are some of the procedures we can do for,
Samuel, so far?
So far, so good.
Yeah.
Yeah, this is, I think, the 6th day, 5th or 6th day after the procedure, and I'm feeling a little bit great. Because, like, if I compare for last week and the other procedure that were done, the neck was still kind of stiff. It was not able to freely move. Yeah. And also, I recognized that they were able to see another contract that I was not able to actually feel it at any given moment on this side. So they were able to release it again, and I feel like my the weight that I had all over my shoulders is kind of getting relieved day by day. Okay. So it's a journey, like you said, and I'm very positive about it to getting better.
What about the parts that were gotten from the hip and the hand?
They're a little bit painful, but it's now the manageable pain, not like after theater. It's now the manageable one, just the normal painkillers. Yeah, because it's majorly on this part. I think it was around 50 centimeters. The way from here to here. And then the other part that was done previously on the hand. And then where they put also the flaps. Okay. So it's kind of, it's a new tissue in a new area trying to also adapt.
Okay. Yeah. Yeah, and I take this opportunity now to throw the questions, and the floor is all yours, our dear audience. And I will start with Samuel's wife. Maybe take us through not even the procedure, when you guys met, how was it for Samuel, and the journey, how has it been so far? For both of you, yeah.
Okay, thank you for this opportunity.
Yes.
When I met Samuel, we met at our workplace. He was my boss. And yeah. And it was not easy. I'll start by saying it was not easy because after some time, I realized that there were things that he was going through. And it was not also easy for him to tell me what happened to him. He used to lie. And
what did he used to say?
It was something that caused by gas, an explosion by gas. That's what he used to say.
Okay.
Yeah, and after finding what happened to him, it was not easy. Yeah. It was not easy. And also having to introduce him to my friends and my family. People will start asking, what happened to him? What happened? It was not easy to get to tell them what happened to him. But I would say it's God's grace.
Yeah.
Yes.
And all through the procedure, I'm sure you're there cheering him on, yeah?
Yes.
Expecting amazing results after this.
Sure.
Yes. Sure. Okay. Thank you so much for being a supportive partner in all this. And anyone else who has a question? Yes, thank you.
I'm now becoming more curious and more curious about the explanation from the doctor. There are people born with a disability, let's say, for example, a missing limb or missing fingers. Can you consider that also as a way of, can you do that? Can you improve the, can I say it, can you add the remaining part of the body? Another question seems funny is that there are people who are ugly. Can you improve their faces to look more beauty? Can you beautify the face of one because you are improving the skin of someone?
So can you make someone handsome or beautiful through cosmetic surgery?
I think we also have to understand that we are working within practical limits. So depends on specifically what someone wants. Like saying, if you say my eyes are saggy, we can sort that out. If you say your nose, we can play around with that, your lips.
I want
but
dimples.
you know, totally change it.
Yeah.
If you want dimples, we can give you dimples. But if you want to be like, if you just walk in and randomly say, okay, I want to look like Beyonce, I mean, like, where are we even starting? You get so. There are people with something called body dysmorphic disorders.
Yeah.
These are kind of people with unrealistic expectations, and we don't operate on those. Yeah, we're just like, oh, you know what, maybe what you actually need is counseling. Maybe it's actually a psychological issue, which is manifesting as your need for surgery. You don't really need surgery, you need psychotherapy.
Okay, but at some point you have to connect cosmetic surgery together with social cultural beliefs, and in terms of mental wellness, it's about low self-esteem. So people attach the two together. Do you offer therapy as well?
Well, we try and offer holistic care.
Okay.
Yeah. See, even the motivation. Okay, suppose I'll give an example. A young lady like you comes, you say, I think my husband is catching an eye for other people, so I want you to do 1, 2, 3 for me, right? Yeah. So your motive for doing that surgery is maybe to retain your husband's interest, which might not work.
Yes.
And when it doesn't work, who will you blame? Most probably me. You get, so when someone's motive is off, you kind of like lead them to, we have psychologists within our practice, and you're like, oh, maybe you need to think this through, because you might invest in something so much with your ultimate end being to get your husband back, but then it doesn't work that way. So we offer holistic care. See what the motive is. If you then just come and you say maybe, oh, I've done everything with my kids, I just want to have a mommy makeover. For me, that is more of a healthy motive, and we'll be able to work together to get the results that you want. Yeah,
that is good. And he had 2 questions actually.
And my other question was, suppose someone is missing part of the body. For example, someone is missing the remaining part of the hand, for example, from the elbow to the fingers downwards. Can you also do the body tissuing and ensure that the guy or the person gets the remaining part?
Okay,
Thank you.
I think yes and no. It's patient specific. If there is anything we feel like we can change from a plastic surgery perspective, there are operations that we can do for missing limbs. But in some cases, maybe the patients will be better suited for prosthetics. Like they can just use a prosthetic arm or something. That would depend on what exactly is missing. Is it bone? Is it just soft tissue? Is it muscle? Are they nerves? So I'll put it at it's patient specific, and there is a role for plastic surgery. What such patients would need to do is come and we review them, then we tell them available options.
Yeah, my name is Emmanuel. From most of the cosmetic procedures, we see that they are there for the ladies. Are there any aesthetic procedures that are there for men? And another question is there any weight loss procedures or weight adding procedures that one can do?
Okay, thank you. Yeah, we do see a number of men coming for procedures like aging. I don't think anyone wants to be old. So also a lot of men come for facelifts, fillers for wrinkles, and those sandbags, they come for blepharoplasty and stuff. But men also do get liposuction when they feel like, oh, they've gone to the gym so much, but the results are slow. They come and we surgically remove the fat. Men also get tummy tucks. Then some men have something called moobs, men boobs. Yeah, it's medically we call it gynecomastia. And it's a source of embarrassment because you can't confidently remove your shirt. So they can come and redo this kind of reduction surgery. I think Kenya is one of the leading countries when it comes to plastic and aesthetic surgery. Rank it alongside South Africa, Egypt, here in Africa. Then Asian countries like Brazil and China,
Yes.
pretty much comparable. Well, compared to Zimbabwe, I think they're advanced. They're a bit more advanced here. That's why I came to do my training here.
Okay.
Yeah.
So thank you so much for the information and the insights. Thank you, Samuel, for sharing your story. Not as easy, but we pray for total healing,
Sure,
both
thank you.
physical, psychological, and everything, and a happily ever after. Thank you so much for sharing your story. So, Dr. where can we find you in case we need to get in touch?
With Da Vinci Medical Group, it's in Kilimani. You can follow us on any of our handles, Instagram, Twitter, TikTok. Then customer representative will book a consultation for you.
Okay.
Yeah.
I hope the rates are, affordable with Kenyan economy. And,
Since we are now friends, we'll give you special rates.
you need to give our viewers a good rate.
Yeah,
They come,
yeah.
the code is health and wellness,
Yeah.
and you get a good rate from Daktari,
Great.
right?
Sure, that's
Thank
a
you.
deal.
Thank you so much. Where can we find you, Samuel?
So I'm on social media also. Actually, I'm working on revamping my YouTube channel to be talking about this.
You
things
have
that I'm
one?
currently. I just started it the other day. It doesn't have much of content.
I can tell the influence. I can tell.
So the reason why I did all this is I just looked back at the whole process we have been, and I felt like there are a lot of people who don't have that opportunity to actually get that, let me use the specialized treatment. Because when you get into an hospital with such kind of issues at the contractures, you are not given more information about what is actually ailing you or what is the problem. You're just being told we'll book you for theater and that's all. Then after theater, you're not told again, you'll take this much time to heal. We are just expecting. It's not like after a day or 2 days you're okay. No. There's another process that begins from that point. Oh, this is the medication that you should be taking, this is the type of food you should be eating, that kind of information. You just discharged and told to go home with just painkillers. So then you get back again on your feet, and then the same thing that was previously treated reoccurs again. Like that's why I went through all those procedures. So there's a lot of lack of information in terms of the procedures that people are getting, especially in public hospitals. There are people who are in areas where they cannot actually access that information. So how do we ensure we reach them and actually they can get such benefits? Like you told utapona,
Yes.
but how? You told something like, if this reoccurs, you need to do 1, 2. But the info is not clear.
Yeah.
Utapona, then I just go home feeling good because of the word that nitapona. But what if I don't get to that point? What next step should I be taking? There are people who cannot afford such procedures. Some of them are being offered in public hospitals, others are being offered in private hospitals. It depends on the financial capability. Yes. But when you look at sometimes at some of these hospitals or the institutions, there is an overbooking. And there's a lot of, let me use this word, negligence and probably sabotage again at the same time. It's something that I've seen. You book from a public facility, a theater, for such a procedure like the doctor was explaining, and you're told the theater is available after 3 months. But I'm really suffering at that point. So what should happen next? Or you told we are waiting for approval on NHIF, maybe. NHIF takes a month for them to approve until sometimes you take, like personally I had to take myself there physically.
Yeah.
And when you get to the reception, they call someone, then you explain your issue, then they tell you, we will send you a message. No, I went there and I was like, no. I need to talk to that person one-on-one. The person who is on the other line, I need to see them one-on-one because they really don't understand what I'm going through. Mimi ndo naumia, it's not them. And when we met a certain guy, that is when now the thing became like so transparent now. Like I'd come out of a procedure and there's another procedure that's supposed to happen. Yes. And if it doesn't happen, this is becoming worse. So you're not just telling me to go back to Ushago and stay there. No. So there's a lot of, that's why I was going through such scenarios. Sometimes when you're walking in town, you meet some of these guys, like the beggars. Some of them have these bands. been through, either through an explosion, either through someone they once knew, or just an accident, and they're just begging for food.
Yeah.
But there's more that can be done to their hands. Like there's one along, I think it's Luthuli. The arm, it's kind of connected kabisa hivi, it cannot move. But if that can be corrected, either through the Social Securities Fund or through other means that we're going to actually mobilize and get them get better, then it becomes easier for them to move from that one point to another, or even become dependable on themselves.
Yeah.
And that is my goal.
What's your YouTube channel called?
It's Cycling Mbithi.
Sir?
Cycling with the CYCLIN, then Mbithi.
They'll come and get that
Yes,
information.
all my
there.
socials are just on the same name.
Okay.
Yes.
Thank you so much for sharing your story. And this has been a great show for sure, and I hope you've learned a lot. In case you missed this, on YouTube, you can find it at Health and Wellness on KTN Home platform. At social media, we are at KTN Home and at Zaitun Ali. So thank you so much for tuning in. Until next time, goodbye.